everybody. At this time, I will discuss case study 20 with title Acting Without Prior Consent Due to an Unforeseen Medical Problem. And the question is, should Dr. C have postponed the operation until Mr. M was able to give his consent? And the meaning of informed consent is the consent given by the patient or immediate family after obtaining a complete explanation of the medical treatment action to be performed on patient by the doctor and medical team. When a patient comes to the doctor to consult to the doctor, the patient is actually entrusting himself to the doctor with all abilities and knowledge a doctor, and patient just hope the doctor can overcome the health problem in himself. To maintain the trust and ask from a appreciation for the trust, every medical action that will be carried out must be clearly state the purpose of action, the way to take an action, alternative action, level of success, and possible risks. Every action must be approved by the patient or his family. Judging from the law of the medical treatment, medical action is legal action. The legal relationship between legal subjects in the form of an agreement that will give rise to right and obligation for legal subject. All medical procedure must be based on informed consent. Informed consent becomes a form of communication between doctor and medical staff and give patient time to ask, to approve, or to refuse treatment. Informed consent help patient to be more educated about personal health and medical treatment, and is a form of voluntary decision to undergo medical treatment. In some situations, makes the patient unable to give consent, such as a patient who is unconscious or in a coma. There are also that situation make informed consent unnecessary, such as emergency situation. In an emergency situation, medical team and doctor will approve informed consent from family members. And however, if there is no family members present, the doctor will take the necessary medical procedure to save patient life. In general, touching or carrying out an intervention physically to someone without agreement is considered as persecution. But in emergency situation, is legally the doctor has medical authority. In this situation, a medical action can be taken immediately by the doctor to save the patient's life without having to ask for consent. And based on this case, the doctor removed the patient's testicles during surgery. I think it's the right thing to do, because if the testis is not removed, it can lead to a worse medical condition for the patient. In difficult conditions, the doctor must decide the best course of action to save the patient's life. Dr. C. actions are also based on medical science, and he are supported by 3 other surgeons. In this case, despite the urgent situation, the testicle must be removed. Basically, a hernia operation is not an operation that endangers human life. So, the doctor should be able to ask from the approval of the family Mr. M through his medical team for action. That will be done immediately because undesirable conditions occur during the operation.